Hello and welcome. This is a short video about maintaining safety for patients in the labor room. Patient safety is part of risk management under the umbrella of clinical governance. The labor room is a critical care area, which means that patients should be monitored closely as maternal and fetal condition can change rapidly and there is a risk of morbidity and mortality arising in the mother or the baby. Therefore, labor room staff are required to maintain a high level of awareness and practice of patient safety. Patient safety is part of the larger platform of clinical governance. A hospital will implement this platform to improve quality for the staff, visitors, and the patients. In case there is any breach of patient safety, it can lead to a high-risk situation, patient complaints, legal complaints, compensations, or even suspension of staff. The pillars of clinical governance include clinical effectiveness, audit, education, staff management, information, involvement of patients and public. You can try to remember these 7 different elements by making an acronym such as CARE-CIP. ST standing for clinical effectiveness and thereon. The different aspects of patient safety in a hospital include patient-centered care, patient education, clinical excellence, medication safety, infection control, fall prevention, emergency preparedness, effective communication, and equipment maintenance. When we talk about patient safety in the labor room, we can narrow it down and be more specific and mention competent healthcare providers, pain management, patient education, infection control, emergency preparedness, monitoring and assessment, postpartum care, and continuous quality improvement. So in the next slides, we are going to elaborate on each of these points. Ensuring that qualified and experienced healthcare providers are present to care for the patient is very, very important. And the staff includes obstetricians, midwives, and nurses who are present during labor and delivery. Adequate staffing levels are crucial to provide timely care and attention. Providing pain management ensures the mother's comfort and reduces stress during labor. This is now included in the World Health Organization Labor Care Guide monitoring tool. Educating the mother during the antenatal period about the labor and the delivery process, the potential complications, and the importance of reporting any unusual symptoms promptly is very important to reduce the risks of pregnancy and labor. This kind of education is continued during labor and in the postpartum period. Communication is important between all members of the healthcare team. Communication is between each other and between the teams as they come on duty. Labor Care Board is traditionally an important tool for maintaining and upgrading information about patient progress and care for all team members. Implementing strict infection control measures will prevent the spread of infections to both the mother and the newborn. What are the infection control measures in the labor room? These include hand washing and antisepsis, use of personal protective equipment when handling blood, body substances, excretions, and secretions, especially in infectious patients, appropriate handling of patient care equipment and soiled linen, prevention of needle stick sharp injuries, cleaning of the environment, and management of spills. All this is included in infection control. Emergency preparedness ensures the healthcare team is trained for emergency situations. Emergency protocols should be in place for scenarios such as hemorrhage, fetal distress, shoulder dystocia, eclampsia, patient collapse, and other such complications. Regular assessments of fetal heart rate, contractions of the uterus, and maternal well-being are essential. Continuous monitoring of the mother and the baby's vital signs help to identify any abnormality very promptly. Continuous tachography or CTG tracks the baby's heart rate on a continuous basis and even during the mother's contractions to identify signs of distress. Intermittent auscultation with a Doppler device or a Pinard stethoscope can be used effectively when continuous monitoring is not available. Postpartum care is a very important part of the care of the patient who has just delivered, and complications such as postpartum hemorrhage, eclamptic fit, or infection can arise in the postpartum period. Providing appropriate postpartum care to monitor the mother's recovery and address any complications that may arise is important to maintain patient safety. Postpartum care will also include care of the mother, baby, breastfeeding, and advice for contraception. Implementing a system for continuous quality improvement includes regular reviews of adverse events, near miss, and feedback from patients. The birthing facility should adhere to safety standards, and the protocols in place must be updated and regularly assessed based upon current evidence. If an adverse event takes place, the hospital staff must take responsibility for debriefing the patient and the husband. To summarize, we need to have fully credentialed staff which is capable of providing services, maintain infection control, educate the staff as well as the patient to ensure preparedness, have effective communication between all the members of the team as well as the members of the teams that are now coming on duty, have a commitment to evidence-based practice, and contribute to ongoing improvements in patient safety. With this, we come to the end of the video. If you like the video, please press the like button, subscribe, share, and give for comments. Press the bell icon if you wish to be notified about future videos. Thank you and goodbye.